Good afternoon. With another topic this time. I think it's already 12 o'clock, yeah? Let's start now. I live in, I'm doing this live from Dubai, and I live here for the last 20 years. As per our Ayurvedic textbooks, Dubai is a Jangala Desha. It's a deserted place. Usually, a Jangala Desha is Vada Pitta Bahulaha Sthira Kathina Manusha Prayogajneyaha. So this time also, I'm doing the session exclusively for the Ayurvedic practitioners. So I'm using, a little more of Sanskrit terminologies and the slokas from our classic textbooks. So I was telling, a Jangala Desha is generally Vada Pitta Bahulaha Sthira Kathina Manusha Prayogajneyaha. However, this Jangala Desha is inflicted by a Kapha Vigara to the extent that 1 in 5 people in UAE is likely to be suffering from diabetes, and 47.5% of the UAE residents are overweight in nature, while another 13% they are obese. That is, in the population, 47 plus 13, almost 60% of the population is overweight or obese, though our Acharya says Jangala Desha is Vada Pitta Bahulaha. What an irony. And as we all know, Ayurveda is a guna-based science. We have studied about the Paradi Guna, we have studied about the Vimshadi Guna as Guru Manda Himasniktha Slashna Sandra Mrdustiraha Gunaha Sasushma Vishada, and the opposite qualities as the basis of the Tridosha Siddhanta. Though there are many gunas explained here, these can be grouped either into Brahmana or Lankana. Otherwise, it can be grouped under Sandarpana qualities or Sandarpana Guna or Apadarpana Guna. Brahmanam yat Brahatvaya. The process of increasing the bulk of the body is called Brahmana. So the qualities like Guru, Shita, Sniktha, Manda, Sthira, Sleshna, Pichila, Sthoola, Bahala, all this goes to the Brahmana qualities or to the Sandarpana qualities. Brahmana is associated with Kapha qualities and mostly opposite to Vata and Pitta qualities. Maybe only Shida Guna is attributed to Vada from the Brahmana qualities. Vadam is Abadarpana Shidam and Kapham is Sandarpana Shidam. Also, when you look at the Pitta qualities, only the Sniktha Guna or the Drava Guna might be coming from the Sandarpana. Otherwise, most of the Brahmana qualities are associated with Kapha qualities and which are opposite to Vada Pitta qualities. There are several conditions where Brahmanam is indicated. For example, chronic diseases, regular usage of medicines, addicted to alcohol consumption, continued sexual activities, depression, grief, increased physical activities, injury or trauma, increased Vada conditions, pregnancy, lactating mother, children, aged individuals, and also in the Grishma Ritu, Brahmanam is indicated. Brahmayet Vyadhi Paishajya Madhya Strishoka Karsidan Bharatva Urakshada Ruksha Durbala Vadalan Garbhini Sudiga Balavrithan Grishmetu Aparanabi. In all these conditions, Brahmana is indicated. How to do Brahmana? Brahmana is done with Mamsa Shira Siddha Sarpir Mathura Sniktha Vastibhihi swapnashayya sukham abhyanga snana nirvriti harshanaihi. However, this Adi-Brahmana, sometimes, it can lead to several conditions. Adisthaulya, apaji, meha, jora, udara, bhagandaran, kasa sanyasa kratsrama, kushtadin adidarunan. So, Adi-Brahmana can lead to conditions like Adisthaulyam, Prameham, Jwaram, Udaram, Bhagandaram, Kushta, or the skin conditions. All this comes to the Sandarpanotha Vyadhigal, or it comes because of the Adi-Brahmana. So, let's understand, Sthaulya a bit more. Let's look at the Nidana of the Sthaulya. One of the major Nidana of the Sthaulya is Avyayamad. We have studied, the Vyayama Guna as Lakhavam, Karma Samarthyam, Deepto Aknirmeda Sahashayam, Vibhakta Kanagatratvam, Vyayamadu Vajayade. On the other side, Avyayama can lead to Guru Guna Vritti, it can lead to Agni Mandhyam, and it can lead to accumulation of the Medas. The second major cause of Sthaulya, as Ayurveda says, is Divaswapna, that is sleeping in the daytime. And Ratrau Jagaranam Ruksham, Sniktham Praswapnam Diva, that is sleeping in the daytime will increase the Sniktha qualities in the body, while keeping awake at nights might increase the Ruksha qualities. And the third cause, Sleshmala Ahara Sevanat. Which Ahara is Sleshmala? And we studied Swadamla Lavana Sniktha Gurva Pishyandi Shidalehi. Swadurasam, Amlarasam, Lavanarasam, Sniktha Guna, Guru, Apishyanti, Shida Gunam, all this will increase the kapha or the sleshma in the body. Now, as per the Kshiradati Nyayam, we have studied that the food nourishes rasa, and the rasa in turn nourishes the rekta, then mamsa. Sarastu saptabhir bhuyo yathaswam pachyade yaknibhihi rasad rektam tado mamsam mamsat meda tado asti astno majja tada shuklam. So, the progressive transformation of the body tissues are mentioned as per the Kshiradati Nyaya. Imagine if there is a problem at the level of the Medo Dhattvagni, which is responsible for the transition of the Medo Dhatu to Asti Dhatu. And when this nutrition shift is hampered, more and more fat tissue is being produced, which is not being converted to the Asti Dhatu or Majja Dhatu or Shukla Dhatu. And we know that the Medas and the Kapha, they are interconnected. Tatra Astine Sthido Vayu Asriksvedayo Pittam Shesheshu Sleshma Tasmad Egavrathishaya Karanatvamesha. So that means the increase of the Medo Dhatu increases the Kapha. The increase in the Kapha, it results in the increase of the Medo Dhatu. Tasmad Egavrathishaya Karanatvamesha. So the Samprapti of the Sthaulya, it is like this. Because of the Nidana Sevanas, the Sleshma Vritti and the Sama Rasa Ulpatti happens, which increases the Mathura, Sniktha, Shida Guna of the Anarasa. And this Nehamsha, when it gets transmitted to the Uttarotara Dhadus, and when it afflicts the Medo Dhatu, it results in the Medo Dhatu Vritti and Dhattvagni Mandhyam of Medo Dhattvagni, which leads to the Medo Vahasrodo Dushti and resulting in the Sanjayam of the Apajida Meda in the Spik, Sthana, Udara and the Sthaulya results. Keep it in mind, the Sanjaya of the Apajida Meda. We will discuss it further. And Vakpada says, Gurvadi Vritta Samlinaha Sleshma Misro Annajorasaha Amayeva Slathi Kurvan Thadun Staulyam Upanayet Srodasu Medorutheshu Vayu Koshte Visheshadaha Charan Prajwalayat Yakdim Shutrishau Tado Adhikam. So the Vada Prakopa is also taking place because of the Avarana or because of the Srodhorodha. The Vada Kopa, which is happening in the Koshta, results in the increased appetite, binge eating, and Adiyahara Sevana, and the Staulya increases. The food intake, it is regulated by the centers in the hypothalamus, which we know the satiety center and the feeding center. And let's understand, two hormones in this context. Ghrelin, it's a hormone, otherwise called a hunger hormone. It stimulates the feeding center, increases appetite, and increases adipose deposition. When the stomach is empty, ghrelin is absorbed. Ghrelin, it is spelled like Ghrelin. And when this stomach is stretched, the secretion of the ghrelin stops. Ghrelin plasma concentration also increases with age, and this may contribute to the tendency for weight gain as the people age. Leptin is another hormone which is called the satiety hormone. Leptin inhibits hunger and stimulates the satiety. Obese people generally exhibit a higher concentration of the leptin than the normal weight individuals. However, obese people show a resistance to the leptin. Obese people show a resistance to the satiety hormone, similar to the resistance of insulin in the case of type 2 diabetes. And with the elevated level of leptin, it fails to control the hunger and it fails to control the body weight. And the Agni and the Vada, it blight an obese person as a wildfire destroy a forest. That's what Ayurveda says. Vitiated doshas, and they cause severe diseases and rapid deterioration of the life. Look at the Lakshana of Staulya. Is Adhistaulya a Vyadhi? Yes, it is a Nanatmaja Vyadhi of Kapha. Medo Mamsa Adhivarthatvat Chalaspik Udarastanaha Ayatha Upajaya Utsaho Naro Adhistula Uchire. Excessive accumulation of the Mamsa, Meda, flatty abdomen, buttocks and the breasts, it's seen in the obese individuals. Adhistaulyat Adi Shutrat Prasveda Shwasa Nidrada Ayasa Akshamada Jalyam Alpayur Belavegada Daurganthyam Gadgadatvam Chabhaved Medo Adi Bushtidaha. And Charaka explains the 8 inherent defects of obesity. Number 1, reduced lifespan, restricted or limited movements, debility of the dhadus due to dhadu imbalance, emit bad smell due to the fatty tissues as well as due to the excessive sweaty nature, profuse sweating because medas and kapha both are vitiated here, excessive hunger and excessive thirst due to the digestive agni and the vayu working in the body. The types of Staulya are also mentioned while explaining about the protocol in Vagbhada. Adhistaulya, that is, Tatra Samshodhanehi Staulya Bala Pitta Kapadigan, and Madhyastaulya Prayaha Purvam Pajana Deepanehi, Hina Staulya Baladigan Shutrishna Adigrahehi. So you can vaguely it can be categorized into Adhistula, Madhyasthula and Hinasthula. Go through that Ashtanga Sangraham Vagbhada slogam once again. Gurvadi Vritha Samlinaha Sleshma Misro Annajorasaha Amaeva Slathi Gurvanthadun Staulyam Upanayet Srodasu Medorutheshu Vayu Koshte Visheshadaha Charan Prajwalayatyagnim Shutrishau Tado Adhigam Sthulam Kodaravat Vrithau Dahadau Agni Anilau Jadam Swedavahi Siramula Bhaved Vishindanadabi. In the case of Sthoola, it's compared to a huge tree with a big hollow inside and the fire and wind working inside. It says the main nourishment is taking place for the Medas, and hardly tatsesho alparaso alpattu annalam rektadi pushtaye, and rektadi dhadus are not getting proper nourishment. A pathology of the prameha can easily start in this scenario as the favorable dushya. The favorable dushya here is bahu abaddhameda and the nidanas are there. Bahu abaddhameda is otherwise called asamhadam medas. Bahu abaddhameda is mentioned as the main pathological factor for the genesis of prameha. Bahu abaddham medo mamsam shariraja kledaha shukla shonida vasa majja lasiga rasa ojascha. They are considered as the dushya of prameha. Another interesting thing to note here is the purva rupa of the prameha is considered as the symptom of medovahasrodas. Note that the purva rupa of the prameha is considered as the symptom of vitiated medovahasrodas. Excessive sweating, body odor, lack of stability in the body, tiredness, feeling comfort in the bed, heaviness in the body, excess hair and nail growth, affinity for cold, dryness of the throat, that is the Svedanga Gandha Shidhilatvamange, Chayasana Sopna Sukhapishangaha, Hridnetra Jihva Sravanopadeha, Khanangada Kesana Kadivritti, Shida Priyatvam Galadal Shosho, Madhurya Masye Karapadadaha, Bhavishyado Mehaganasya Rupam, Mutre Abhitavandi Pipilikasya. All the dosha chaya or the sleshma chaya lakshanas are seen here. The vitiated kapha is the initiator of the pathology. Let it be in both prameha or in Sthaulya. As the birds are attracted towards the tree where the nest lies, similarly, prameha affects who are leading a sedentary lifestyle and who are voracious eaters. Gridnu abhyavahareshu snana sankramanadvisham prameha shipramabhyedi nijadrumamivandajaha. And immediately death comes in the form of prameha to those who are less enthusiastic, obese, over sniktha, over anxious and gluttons. Manda utsaha adisthulam adisniktham mahashanam mrityu prameha rupena shipramadaya gachadi. And we know that there are only very few number of say like insulin receptors on the walls of cells in an overweight individual. Hence, more insulin is required for the cells to absorb the glucose. By the weight reduction, the number of insulin receptor sites increases, and this reduces the severity of hyperglycemia in diabetic patient. Now, in the context of prameha, we need to understand the concept of kleda a little more. Kleda, we studied about the kledaka kapha, as the moisture required for the smooth functioning of the subtle digestion. Amashayastam tu annasanghadasya kledanal kledaka. And however, here the kleda gets stagnant in the medovahasrodas with obesity. Prameham is also a kleda pradhana vyadhi. At Mahabhuta level, the kledam is a material which is Jala Mahabhuta predominant. So with regard to the Tridoshas, both Kapha and Pitta contribute and regulate the kleda. And all the kleda which is being formed in the body is drained to the Mutravahasrodas, and then it is thrown out of the body via urine. Mutrasya kleda vahana. It is a function of urine to take the kleda out of the body. Coming back to prameha, it says, Sarvajatvat mahamarma samsrayat anusham gadaha subahu upadravatvacha prameho daruno gadaha. The last week, I spoke about another Mahamarma Samsraya Asraya disease, which is the migraine. And Prameha is also based on the Mahamarma, which is the Vasti. And Prameham is a Maharoga. Vadavyati Ashmari Gushta Meha Udara Bhagandara. Prameham, of course, it comes in the Maharoga. Look at the Prameha Nidana. Ayurveda says, Uttarothana Prameha is Narasya Swagrada. That is, it is due to our own misdeeds. That is, Apatyahara Nimittadaha. Let's explore the causes. Asya Sukham, comfortable and sedentary lifestyle. Swapna Sukham, comfort of sleeping. Dathi, Gramya Udaga Anupamamsam. Payamsi, that is the excess consumption of milk and the milk products. Nava Annapanam, food and drinks from the new grains. For example, every day we eat dosha with ghee. The new masha with ghee is considered as a nidana of prameha. Gudavaigrada, jaggery, sugar, etc. Kapharkracha sarva, and all the other ahara viharas which increase the kapha are considered as the nidana of prameha. Medomutra kaphavaham, annapana kriyajadam el prayastal pravartagam. Swadamla lavana snikta guru pichila shidalam navatanya suranubha mamsa ikshu guda gorasam ekasthana asana aradishayanam vitivarjida. You may also note that the amla lavana rasa pradhana ahara and the foods like sura, dathi, divaswapna, they aggravate both the kapha and the pitta. Let's look at the Samprapti. In the Samprapti of Prameha, it says, Vastim asritya gurade pramehan dushidaha kapaha. So, Asraya Sthanam is Vasti. Doshohi Vastim samupetya mutram sandushya mehan janayet yathaso. No doubt, Vasti is the Asraya Sthanam. Kaphassa pitta pavanascha doshaha medo asra shukla ambuvasala majja rasa oja pishidamcha dushyaha pramehina. So it's not only, the tridosha involvement which is happening there. All the dhadus other than asti is getting dushta in the case of prameha. The steps of samprapti, it can be summarized like this. The nidana sevana of the guru sniktadi ahara and avyayamadi vihara and leads to the kapadosha sanjaya, and the vitiated kapha, it has an affinity towards abattha meda due to the similar properties and get lodged there. Medo vilenam happens, kledavritti happens, and it vitiates the mamsa. When the mamsa vitiation happens, pidaga ulpatti is taking place. Now the kleda is coming to the vasti, vitiate the mutravaha srodas, and gradually involves all the dhadus. And dhadunam cha shaithilyam ojasascha gunasheha. It leads to dhadu shaithilya, just like excess watering will not nourish but destroy a paddy plant. What is the opposite guna of shaithilyam? Opposite guna of shaithilyam is dridada. What is the best regimen to gain dridada? Vyayamo dardhyagaranam sreshta. So that is why exercise is having a prime importance in the treatment of prameha, because dridada is just opposite to shaithilyam. And the involvement of the other doshas also takes place and leads to various types of prameha. The samprapti of the prameha can be better understood by knowing the concept of vikara, vikada bhava, abhava vishesha. So the nidana, dosha, dushya, these are the three responsible factors for producing vikara, vikada, abhava. So two negatives are coming here. So it becomes vikara bhava. And not producing the disease, that is vikara, vikada bhava of the diseases. If these three, that is the nidana, dosha and dushya, do not combine with one another completely, or if they unite poorly due to the lapse of kalam, etc., then there will be either a non-production of the disease due to the weak nidana, weak dosha and weak dushya, or production of the disease after some time, or manifest mildly or without all the symptoms mentioned in the diseases, say like in the Purvarupa Lakshanas or in the Kapha Prameha Lakshanas. Or on the other side, a Prabala Logolpati with all the Lakshanas and with the proper Anubandha of Nidana, Dushya, Dosha, all this takes place. So these four possibilities are there. So Prameha can develop usually in two ways. Sometimes it can be an acute origin. Due to the dosha kopa karanas, kapha, pitta or vada vitiate and in tathatmaka sharirasya shipram apinivartayadi. So if the kleda, meda, kapha, dushti is all there, tathatmaka sharirasya shipram apinivartayadi. So Prameha can sometimes be of chronic origin due to progression from the Kaphaja Meha to the Vadika Meha. In Kaphaja Meha, Vagbhata says, Vastimasritya Gurude Pramehan Dushidaha Kapha Dushayitva Vabu Sweda Kleda Meda Rasamisham. So all these are getting dushta in the case of Kapha Prameha. When this Kaphadiha, they become Shithila, Rekta Pitta Dushti happens and Pitta Prameha develops. So the Kapha Prameha, it's getting transformed to a Paitika Prameha. And Pittam Rektamapi Shine Kaphadau Mutra Samsrayam. So that is how the Paitika Prameha develops. And when the Shreya happens to Pitta and Rekta also, then the disease progresses into Vadika Prameha. Thadun Vastimupaniya Tat Shayepi Jamarudaha. And we studied about Madhumeham. Madhumehi Madhusamam Jayate Sakiladvatat Kruthe Dhadushayat Doshavrada Patheyatava Avrudo Doshalingani Sonimittam Pradarsayet. So that means when the Madhumeha is of Avarana kind, it shows the Avaraka Dosha Lakshanas sometimes. So Madhumeha, it can be sometimes of due to Avarana Samprapti, or it can be also be due to Dhadushaya. So generally the word Prameha and Madhumeha, they are used as synonyms, but Madhumeha, as we know, it is a type of Vadaja Prameha. Kalena upekshita sarve yadyandi Madhumehada. Look at the Lakshana of Prameha, very interesting. Samanyam Lakshanam Tesham Prabhuda Avila Mutrada. Prabhuda Mutrada is also seen in conditions like Amajwaram, Amavadam, etc. While Mutra Graha is seen in Adilankana and Mutradhikyam is seen in conditions like Adibrahmanam, Prameham, etc. Not only Prabhuda Mutrada, Avila Mutrada is also a symptom of Prameham. And in the Prameha Mukta Lakshanas, our Acharya says, Pramehino Yadamutram Apichilam Anavilam Vishadam Tiktagadugam Tad Arogyam Prajashade. So Avila Mutrada and Prabhuda Mutrada, these are the two main symptoms of Prameha. And how do we diagnose, the Vadika Meha or Kaphaja Meha or Paitika Meha? It says, Mutra Varnadi Bhedena Bhedo Meheshu Kalpyade. Is it practical, to assess whether it's a Kaphaja Meha or Paitika Meha in a clinical scenario? It's tough actually. We have an easier tool therefore, which is called the Upadrava. And explaining about the Upadrava of Prameha, Vagbhata says, Vadiganam Udavartaha Kanda Hrilgraha Lolada Shulam Unnidrada Shoshaha Kasashwasascha Jayade. And for Paitika Meha, Vasti Meheneyo Todaha Mushkavadaranam Juraha Daham Trishna Amlago Murcha Vidbhedaha Pitta Janmana. And for Kaphaja Meha, Avibhagam Aruji Chardi Nidra kasasapina saha. Upadravaha prajayande mehanam kaphajanmana. So, the assessment of the Upadrava can be used as an excellent tool to differentiate the dosha involvement in Prameha in a clinical practice, rather than going for assessing the color of the urine or the avilada of the urine. The types of Prameha are mentioned by the Acharyas according to the causes, that is Sahaja Pramehi or Apathya Nimittaja Pramehi. Sahaja Pramehi is usually Krisha in nature, while Apathya Nimittaja Pramehi is generally Sthoola in nature. And according to the Agradi, Pramehi can be Sthoola or it can be Krisha. The early stages of diabetes mellitus type 2 is generally Sthoola in nature. The later stages of diabetes mellitus and the type 1 diabetes mellitus are generally Krisha in nature. According to the dosha, we studied that Kaphaja Pramehi are of 10 types and Pittaja Pramehi are of 6 types and Vataja Pramehi are of 4 types. And coming to the prognosis, Apathya Nimittaja Prameha, Kaphaja Prameha, Sthoola Pramehi, they are all Sathya in nature. Pittaja Pramehi is Yapya, while Sahaja Prameha, Vadaja Prameha and Krisha Prameha are generally Asathya in nature. Now let's, it's already 30 minutes, let's quickly go to the management of Prameha also. Since Prameham is a Sandarpanotha Vyati, the treatment should be Apadarpana. Sthulamscha Lankayet Nityam. The reversal of the Samprapti will be easy and quicker if it is diagnosed and if it is treated at the earliest. The primary importance in the Chikitsa of Prameha is the management of Kledam, Medas and Kapha. The management of Kledam, Medas and Kapha. Kledascha Medascha Kaphascha Vritthim. Prameha hedu prasamikshyatasmat. Vaidyena purvam kapha pittajeshu meheshu karani apadarpanani. The Shodhana therapies are significant in the management of Prameha as it is a Bahudoshaja Vyati. Why I am telling it's a Bahudoshaja Vyati? Because the combination of the Kapha and Medas is happening there. And among the Panchakarma procedures, Vamana has been given more importance because it is Kapashamana. And the Sneha Dravyas for the Shodhana Purvaga Sneha Prayogas, Sneha Dravyas like Sarshava or Nimba may be used in diabetes. Care should be taken because Nimba may cause vomiting in the patients, while Sarshava can be used very effectively. And going to the Snehavidhi Adhyayam, it says, Granthi Nali Krimisleshma Medo Marudarogishu. Sleshma Medo Marudarogishu Tailam Lakhavadardhyarthi Krura Koshteshu Dehishu. Prameha Rogi is Dardhyarthi and Prameha Rogi is Krura Koshta in nature. So Tailam is good than the ghee prayogas. The treatment principle is Medo Anila Sleshma Nashanam. At the same time, the treatment approach should be Dardhyagrat. Usually it is very difficult to find such a combination. That is Medo Anila Sleshma Nashanam and Dardhyagrat at the same time. Tailam is Dardhyagrat. One more clarification is given by Acharya in the Snehavidhi Madhyayam itself. Guda Anupa Amisha Shiradila Masha Suradadhi Kushtashopha Prameheshu Snehartham Na Pragalpayat. So, how can we use Sneha? Triphala Pipali Pathya Gulgulwadi Vipajidan Snehan Yathaswamedesham Yojayed Avigarinaha. So, the Sneha can be prepared with Triphala or Pipali or Pathya or with Gulgulu. It can be used for Snehapanam. Anuvasanam is contraindicated in Prameham, and generally Vasti is also not much used in Prameha Chikitsa. However, Astapanam with Aragvadadi Gashayam or Nigrodhadi Gashayam or Surasadi Kashayam may be given. And note that Svedana is contraindicated in Prameha because the heat produces Medo Vilayanam. Ushnaguna Upahidaha. So Ushnagunam and Sniktha Gunam causes the Vilayanam of the Kapha. And the heat produces Medo Vilayanam, and it increases the Dravada of Kapha and resulting in the Mutra Adipravarti. And note that Adisvedam is also a Prameha Lakshana. And keep it in mind that Pramehi is usually constipated. Tishnam cha shodhanam prayo durvirechyo hi mehinaha. So they are generally constipated in nature. And coming to the Shamana Chikitsa, treatment principle is Amedo Mutralam Vannidevanam Balavarthanam. Amedo Amutralam Vannidevanam Balavarthanam is the treatment procedure. Guru Apadarpanam, Lekhanam, Kashanam, Rukshanam, Kledaharam, these are the kind of drugs we need to use. Ruksham Udvarthanam Gadho, Vyayamo Nisijagaraha. Yatcha anyat sleshma medoknam behirandarscha tadhida. Rukshanam, kleda shoshanam, like you take asanadi or guluchyadi or takrabanam, nimbadi kashayam, these are all ruksha in nature and kleda shoshanam in nature. Medo lekhana drugs can be used, like gugulu can be used, makshayam or honey can be used. Shilajidu rasayanam is mentioned, which can be given at a minimal dose of like 2 to 3 grams. It can be given either with Triphala Kashayam or with Aragudadi Gana Kashayam, and for a week of like 3 to 4 weeks time. Subhavidam Sarajalehi Tulam Pitwa Shilodbhavat Sarambuneva Punjana Shalim Jangala Jehirasaihi Sarvan Abhibhavan Mehan Subahu Ubadravanabi. And it says, Mathumehitvapanno Pishadbhi Parivarjitaha Shilajidu Tulamadyat. So Shilajidu is mentioned as an excellent rasayanam in the treatment of Prameha. And Mrudu Virejanam can be done. It can be done with Trivrit, or it can be sometimes Manibhadra Gulam also can be used. And Kashayam like Asanadi, Varanadi, Tripaladi, Punarnavadi, you all know that. Pathya Punarnavadi, Nisagadagadi, Kadagakadaradi, Aragwadadi, Amradashadangam, Guguladiktagam. We have so many options, in the Kashaya Kalpanas. And in the Churna Kalpanas also, we have several options to use according to the Yukti of the physician. From Gugula Vanjabalam or Vedangadi or Navayasa Jurnam or Mathusnuhi can be used. Shadtharanam, Vaishwanaram, Hinguvajadi, and Meheshu Thatri Nisha, Amalagi with Haridra Jurnam, Triphala Churnam, all this can be used effectively in Prameha Chikalsa as a Shamana Ushadi. Gugulu preparations like Triphaladi Gugulu, Mandura Vadagam, Chandraprabha, Shilajit, all this can be used. Saptamrada Lauham. Lehyam can be used like the Shamula Haridaki, Gomutra Haridaki, Asava Arishta like Lohasavam, Aiskradi are mentioned there. Single herbs are also mentioned here. So the single herbs, which are usually mentioned in the Sneha Vyapat Chikilsa can be effectively used in the Sthoola Pramehi. Like you take Shilajit or take Haridaki, Gomutram, Nimbam, Guluji, Nisha, and Dhatri Nisha, Khadiram, Viluvatram, Durva, Haridagi, Asana, all these can be used in the Prameha Chikitsa. And Udvarthanam with Kolagulathadi, Eladi or Tripaladi can be used. Abhyangam, usually Ushnavirya oil should be used for the Prameha Rogi, like Sashrava Dailam can be used or Kotanjukadi Dailam can be used. Lekhana Vasti can be done, like as Kashayam here we can use either Triphala Kashayam with Dhanyamlam. I have also tried with some Malabar tamarind Kashayam in some patients. Only thing is that the Pitta Vritti happens and we might end up with using an Anuvasanam to reduce the Pitta Gopam. And Yavakshara can be added with the Lekhana Vasti. And going to the Pathya, I'm running a bit quickly. yavam, mudgam, kulatham, lentils like red gram, millet, and tikta shagas like karavelam, jangalamamsam, jambu, dadimam, amalaki, takram, water boiled with khadiram, asanam, or daru haridra. All these can be used as pathya prayogas in the case of prameha. And godhumam is generally better than rice. It says, Santhanagari Mathuro Gothumo Sthairyagratsaraha. Gothuma increases the sthairium of the body. And while in Prameham and in Medorogam, Shithilata is happening. So, Yavam is also Sthairagrat. Bhavana in Triphala Kashayam can have a Kledahara effect. It says, Acharya, Vasideshu Varakwadhe Sharvarim Shoshideshu Aha Yaveshu Sugradan Saktuan. So all the stanyas, let it be wheat or let it be barley, it can be kept in Triphala Kashayam overnight, and the next day it can be dried and cooked, which might reduce the glycemic index of these grains. And in the Chikilsa also, in Ashtanga Hridayam, we studied about specific yogas for Kapha Prameha and Paitiga Prameha as Lotra Abhaya Toveda Katphalana or Padha Vidanga Arjuna. So these small slokas are mentioning about for the Kapha Meha or for the Paitiga Meha. But in the second line is very interesting. It says, Yathaswamebhi Pananam Yava Gothuma Bhavidam. All these kashayas can be used for the bhavana of Gothumam or Yava in the treatment of Prameha. Apatyas are masham or the black gram or urud dal, potato, yam, grapes, mango, banana, yogurt, milk, ghee, sugar, fish, tubers. All these has to be avoided. And also atyashanam and vishamashanam also should be avoided. In the treatment line, from the experience also, exercise, comes the first. Vyayamo dridhigarananam sreshtaha. And healthy eating comes the second, and medicines comes the second. I quickly wanted to, it's around 45 minutes. I hope, I could give justice to this topic. If you have any comments or any questions, please let me know and comment here, and please watch my video. Thank you.